And you can, they'll follow the judges.
Maybe.
Well, good morning again. Thank y'all for being here. Those online, thank you for being here. Thank you for GCC staff and team for hosting us. And thank y'all for traveling in for our in-person meeting. And I'm gonna turn it over to Justice Earls and she'll offer her comments and some brief introductions.
Well, thank you, Secretary Buffalo. I'm so excited for our meeting today, and I want to thank all of you for traveling here, some from quite a distance, to be with us in person this morning. And I'm not going to say much because I want us to go around the room for the task force members and just introduce ourselves, in part because we have some visitors, but also because we don't get to be in person very often. But what I do want to say is that this is, you know, we have the original task force was started in May of 2020. And so we are now 4.5 years into this work. And from my perspective, we have far exceeded expectations in terms of the changes, the reforms, the programs we supported, the incredible work that's been done. And that is due to all of you. That is due to your commitment, giving us your time, the benefit of your wisdom, experience, all your connections in the community. And so that is an incredible accomplishment. And at the same time, I think this work continues to remind us how big the challenges are and how much work there is still to do. And I think part of that is not because of any lack of wisdom, foresight, ability on our part, but we've always known that addressing racial inequities in the criminal justice system and trying to reduce the disparate impact, reduce those disparities, we are not operating in isolation. And whether it was community members or law enforcement or government folks, everyone at some point in the past 4.5 years has said to us that what we are experiencing within the criminal justice system is determined by, impacted by, influenced by racial disparities that we see in education, in housing, in healthcare, in employment, in all those other systems that we had to, and in some instances, you know, when we talk about school to prison pipeline, we're overlapping with education, but we were trying to keep our focus on the criminal justice system. And so I want to applaud all of you for your commitment, for the work you've been doing. And I know that commitment carries forward. So we have an exciting meeting today. We have a report on some research that's been done. We have a panel of community advocates who are going to talk with us about their perspective. And then we have some time at the end of the agenda to talk about what we want to say to the incoming administration about what should happen going forward. And I want to really lift up and thank all of the staff, some of whom are here today, who have worked with the task force, not only recently, but over the past 4.5 years. I think if you look at our year-end report this year, it's incredibly impressive. And we know that work is only possible because of the incredible staff support that we've had initially from the Attorney General's office and now from the Department of Public Safety. So with that groundwork, I want to go around the table and please just tell us your name, your organization, and what your role has been with the task force. And I didn't say this initially. I'm Anita Earls. I'm an Associate Justice on the Supreme Court. My role with the task force has been to co-chair, and because of my role in the judiciary, I've tried to be helpful to the Judiciary Committee. But that's who I am. So I'm going to go to my right.
Jeff Smythe with CJ Standard. And I started not as a full member of the TREC committee, but as in an advisory role, and then was added maybe 2 years ago.
Thank you.
Good morning, Marsh Morey, in the State House now, was a former judge. Been on TREC since the beginning and proud to be the chair of the Juvenile Sentencing Advisory Board. That was one of the recommendations of TREC, and it's been a real honor to do that. Thank you.
Good morning, everyone. My name is April Dawson. I'm the Associate Dean of Technology and Innovation and Professor of Law at North Carolina Central University School of Law, and I am on the Judicial Committee.
Good morning, everyone. My name is Nisha Williams. I am the co-chair of the Judicial Committee, and I'm the legal director at the North Carolina Coalition Against Domestic Violence.
Good morning, everyone. I'm Regina Parker, Chief District Court Judge of District 2, and I'm on the Judicial Committee.
Good morning, everyone. I am Cassandra Hoekstra, and I'm the Chief Deputy. Good morning, everyone. My name is Emily Coward. I am Director of the Inclusive Juries Project at Duke University School of Law and a senior lecturing member of the Judicial Office. I was one of the lead staff people in 2020, and now I'm working mostly with the local committee.
I'm Mike Hawkins. I'm from Brevard, Western North Carolina. I'm an original member of the TREC task force. I was appointed as a county commissioner, and I am chair of the local committee and do whatever Jasmine.
Good morning, everyone. I'm Norland Graves, Chief Deputy General Counsel for the Department of Adult Correction. It's a mouthful. I'm on the executive committee.
Good morning, everybody. My name is Kerwin Pittman. I'm the founder and executive director of a nonprofit called Recidivism Reduction Educational Program Services. I'm on the executive committee and one of the original members of TREC.
Hi, everyone. My name is Berenice Malagon. This is my first time here, and I'm serving for the first time, like about 3 months. I am part of the team in the communications in Chatham County. I also have I'm a host and producer in a radio show in WCOM, and I am also a CEO of Emergente Comunicación para la Gente, which is a marketing and communications for the Hispanic population company. So I'm happy to be here.
Clarence Burkhead, Sheriff of Durham County. I've served on the Executive Committee and the Legislative Committee, and I was appointed 2 years ago.
I'm Tally Wells. I'm the Executive Director of the North Carolina Council on Developmental Disabilities, and I'm quasi part of DHS, so I quasi represent them along with former Assistant Secretary Angela Bryant. And I started this journey at the beginning with Kerwin and Lieutenant Garten.
My name is Billy Garten. I do work for the Raleigh Police Department. However, my spot here on the TREC committee is I'm the chairperson for the executive committee, and I've also been an original member of TREC.
Hi, everyone. I'm Caroline Balland. I'm the Deputy Secretary for Partnership Engagement at DPS. And for those of you that have been with us and worked at all with Brandy, I just wanted to send greetings from her. She was sorry that she's not returned to work. We hope that she'll return to us sometime after the first of the year. She is doing well in her journey, and she sends her greetings and warm wishes.
Good morning. I'm Sherry Hunter, Deputy Secretary for Department of Public Safety for Law Enforcement and Strategic Relations. I am a staff supporter for the Local Policy Committee.
Good morning, Kara Bridges with Policy and Strategic Planning at DPS. I'm staff support to the Executive Committee.
Hello, everyone. Laura Howard, General Counsel at the Department of Public Safety, and I have been lucky enough to staff the Judicial Committee.
Angela Bryant, retired member of the council, of the task force.
Yeah. Hi, I'm Melanie Thomas. I'm a consultant with the North Carolina Sheriff's Association and a retired special agent in safety.
Outreach specialist with the Department of Justice. I'm Gabby Cheer, I'm representing legislative.
Laura Morgan, communication
Well, that's your professional.
Caroline Farmer, Governor's Crime Commission Executive Director.
This was the invisible set. I'm Elaine Evans. I am admin support for TREC and Caroline Bell.
Oh, good morning, Eddie Buffalo, Secretary, co-chair on my co-chair justice. So welcome.
So now we are ready to get our committee wrap-up reports, and in no particular order, but we'll start with the executive committee.
All right, so the TREC Executive Committee spent the better part of 2024 learning from speakers and subject matter experts in the areas relevant to racial equity in criminal justice and the criminal justice system. Some of the key topics included behavioral health funding and Medicaid expansion. The committee learned that there is funding available through the Department of Health and Human Resources for deflection and diversion purposes and for behavioral health programs. With the Medicaid expansion in North Carolina, has requested the approval for beginning to provide certain services for offenders prior to release from incarceration, such as medication for opioid disorder and a minimum of 30 days supplies of prescription medication, case management, and other health-related services prior to being released. We also heard from the North Carolina Law Enforcement Accreditation Program, which is called NCLEA, in support of the TREC recommendation number 46, improving the ongoing development of statewide law enforcement accreditation programs. The committee heard updates from NCLEA. This accreditation program is voluntary for law enforcement agencies in North Carolina. There's no fee for the participation, and at the time of the presentation, 5 entities had already sought and received accreditation from that program. And then we got to what I believe is our bread and butter, the use of force. We went and we heard a number of different presentations for use of force, but some of them were, we heard from the use of force policy from both the state prisons and the local jail settings. The Department of Adult Correction presented on their update as it related to the use of force and their use of force policies, which require officers to use a reasonable amount of force necessary to effect arrest or control. We learned that chokeholds were removed as a force option, unless, of course, deadly force was authorized or justified. It also required the duty to intervene, the duty to report excessive force. The committee also heard from the Buncombe County Sheriff's Office as it related to their use of force policies in jail, which also required a duty to report or a duty to intervene. One of the things that we really tried to focus that particular meeting on was the ability for the incarcerated to report excessive force in jails. And we really wanted to try to figure out a way to maybe put out a thing for best practices as it related to the way jails report the use of force. And really was particular to our group because we understand that folks outside of incarceration have many avenues to report what they believe to be misuse of power or excessive force. Well, what we were not aware of is the avenues that folks incarcerated have to report abuse of power or excessive uses of force. So we really tried to kind of dig down deep into that. The idea of putting a best practice or a standardized use of force reporting is a really heavy lift and a heavy task because we know our jails are ran mainly, our local jails are ran by our sheriffs, and each sheriff has their own authority and power to do that. And so trying to get everybody on the same sheet of music will be a tremendous task, but I think it's one that we're still looking forward to trying to implement and trying to fight for because it seems like the right thing to do for us. And then we heard from the database dashboard. This committee heard from the Department of Public Safety, the Department of Juvenile Justice Division, School Justice Partnership data as well. The State Board of Education presented on their school discipline dashboard, which was part of the project to better collect data to track programs toward eliminating opportunity gaps by 2027. The data include information on suspension, expulsion, alternative learning programs, alternative placements, and acts of crime and violence within our schools. The committee recommended that the dashboards each provide links. We wanted the dashboards to kind of interface, but there were different rules and regulations that kind of prevented that. But so we recommended that they at least provide the links to each other so people can go and compare that information. And then last but not least, we heard about body worn cameras. I don't think there's anybody in this law enforcement arena that can say body worn cameras have not been a benefit. The city of Raleigh, my police department, I'm proud to say, did a presentation to the committee about the implementation of body worn cameras, the lessons that we learned within the agency. We discussed the benefits to law enforcement for implementing body worn cameras and asked that the Raleigh Police Department policy be shared broadly for awareness as a sample for other agencies to consider when adopting body worn cameras as well. The Governor's Crime Commission CEO, Executive Director Caroline Farmer also presented on finding and opportunities for helping law enforcement entities pay for body worn cameras. There's an extended expense to body worn cameras. It's not just buy the camera, throw it on your officers, and that's it. This data has to be captured, it has to be organized, and it has to be in a manner in which you can retrieve it should you need it, and that all costs money. So the biggest expense for body worn cameras is actually storing that data and having it usable and accessible to you when you need it. And with that being said, this concludes my executive committee report for 2024. And I will take any questions if anybody has any. And I have to give a shout out to my staff, Kara and Brandy also, but Kara's been in charge of keeping me on track, keeping me in the right space and in the right place. And she's done a tremendous job at that. And I really appreciate it. Thank you.
This is Tally Wells. I'll just say very quickly on the dashboard, that's a really big victory for this task force. It happened because of this task force to have a data dashboard on suspensions, expulsions, et cetera. This is of huge priority to the developmental disability community because a lot of children do get suspended and expelled and or have homebound in particular based on things arising out of their disability. We had a really good conversation with the Board of Education because, of course, we also want schools to be safe and we want children to be able to all be educated. And so this dashboard really gives us a chance to sort of understand what's happening with children before they get to bigger issues with Lieutenant Garton. So I'm very proud that that's happened. I'll also say that they used temporary funding. So how long that lasts is an issue.
Any other questions? Well, I do want to ask a question as well. This is about the best practices for jails to report use of excessive force. And that is reflected, I think, in the year-end report as something that should be worked on going forward. And I guess my question is there sort of a group of folks who have energy and capacity and willingness to work on coming up with it? Because I understand what you say about the challenges of getting a best practices document. But do you think there's a group of folks we know can call upon to work on that?
I think so. And I think that group is going to be with Sheriff Burkhead's and his influence on the commission with the sheriffs. They run the jails. And if they all sit down and agree that this is the best practice and they want to implement it, then they can. We all know it's very difficult to take constitutional actors and force them to do something. But I think in partnership and in understanding, I think it's doable. We just got to make those right relationships.
And Justice Earls, Sheriff Burkhead, I would agree with that. And there are mechanisms in place internally where detainees can report file a grievance or use of force or just a number of issues that they may be dealing with or feel that have been unjustly, how they've been unjustly treated. But I do agree that there's room for conversation with sheriffs across the state on best practices and looking at policies and reducing the use of force in the facilities across the state. So I think there's an opportunity there.
Does anyone else from the executive committee want to add anything? All right.
And Justice Knowles, I just would remind everybody that in the sample policies that and best practices that was developed in the first iteration of TREC and that's still found on our TREC webpage, there is a use of force sample policy that we've tried to make available. You know, we worked really hard on the DPS use of force policy and showcased it and have pushed that out to others. It's very similar to the I know the Raleigh use of force policy as well. So
I do hear this is something a little different.
Okay.
Am I?
So it is, and I think we're looking at two different things because one was a lot easier to recommend and implement. The other one is, you know, dealing with the incarcerated and their ability to report these things.
Well, we see some of their petitions in our court, but I appreciate that. Okay, well, I think that means we can turn to the Judicial Committee.
Good morning again, everyone. Nisha Williams, co-chair of the Judicial Committee. I'm speaking on behalf of myself and our my co-chair, Judge Thornburg, who is unable to be present today. We're going to go over around 5 different topics that we as the Judicial Committee focused on throughout the year. The first was we continue to spread the information and the knowledge that comes with reentry simulations. Last year, if many of you remember, we held a reentry simulation at NCCU. This year, we were able to host a reentry simulation out west, again, with the work of Judge Thornburg, working with folks out west. They were able to host one there. And then Judge Parker partnered with Eastern Carolina University and hosted one out east this past fall. As a result of those 2 reentry simulations, hundreds of folks attended reentry simulations and were able to gain knowledge on the impact that folks who are reentering into society after incarceration face, all the barriers they face, what it's like to be under time restrictions and have to be able to get a new ID when they don't have access to documents that they otherwise would have, but because they've been incarcerated for 20 years, have no idea where their birth certificate is. And just reminding folks about the real life collateral consequences that folks face when they come out of incarceration. I'd also like to highlight particular work that Judge Parker did. She was actually able to take action within her local sphere and get funding for a re-entry peer navigator in Eastern Carolina. She was able to work with folks, get grant money, because we know all of these things need money, and she was able to lead that effort. That effort began last year after our first re-entry simulation, and I believe this year they were able to begin that program. So the re-entry simulation does work and does affect folks' hearts and minds. And we do encourage that we continue to spread the work of the reentry simulation. I also like to highlight that the Judicial Committee partnered with the DAC and other local reentry groups to make these reentry simulations happen. It did not happen just because we wanted to do them. There's work that's happening in each local area. We also did call to folks' attentions that not every county has their own local reentry program. And again, that is what Judge Parker saw that her community had a deficit in and sought funding and filled a gap. But there are still existing gaps throughout the state, and we want to continue to highlight that work that needs to be done. Next, I wanted to uplift the work that we did around juries. This, I think, has been led by Emily Coward, who is also on our Judicial Committee. Emily led a screening of judging juries earlier this year and a panel discussion, we brought to the committee the idea that jurors should be paid more, and highlighted a documentary from California. And we had the person who created the documentary was also able to share information with us. This documentary highlighted that out in California, they started paying jurors about $100 a day. And what they saw was that folks of color, working class folks really felt more invested in the idea of being on a jury because they were being paid. Right now in North Carolina, our jury fees, the pay that folks receive from being on juries range from $12 to $40 a day in North Carolina. And it's simply not enough for folks who are giving service and time to really do the work of being on juries. And so we wanted to raise that issue. Also on the panel that we did have, one of our other judicial committee members, District Attorney from Orange County, Jeff Neiman, also was on the panel. And so we do really had robust participation from our committee throughout the year. We also did, again, led by Emily Coward, a Justice Unbound symposium that we held, that was held at Duke University earlier this year. In this symposium, there were judges, lawyers, and community members that gathered together and talked about what judges can and should do to address structural racism in and outside of our courtrooms. Sessions that we covered focused on racial equity and legal doctrine and collaborative efforts to build an inclusive culture in the legal system. Again, that group was a wide group of folks. This was held in February of this year, and great information came from it, and we expect to see additional work coming out from Emily Coward's work over at Duke University. We also held a conversation on fines and fees this year. Keisha Millett from the North Carolina Fines and Fees Coalition presented to our committee about just the rising impact of the impact of the rising cost of court fines and fees. In 1999, our court fines and fees were roughly around $61. Now today, it's roughly around $180 or more. So just imagine how that impacts poor folks throughout North Carolina. The coalition shared with us that they estimated that 1 in 12 North Carolinians are living with outstanding criminal debt. One of the other major issues that Ms. Millett shared with us was also their campaign to end driver license suspension as a result for failure to appear in court or failure to pay court costs, which again often exacerbates the cycle of poverty. So many folks we know are in our jails in North Carolina as a result of being arrested for driving on a suspended license, but that suspended license was a result of not impaired driving, but it was a result of not being able to pay their court costs. So it does create a cycle of poverty that many North Carolinians, in particular Black and Brown folks, are not able to get out of. Additionally, Ms. Millett had us focus on, and we have continued to stress the importance of judges and lawyers understanding the 415 waiver form. That was a form, AOC form that was created that allows for judges to waive or reduce court fines and fees, either at the time of sentencing or even after someone has already been sentenced. They can petition the court and seek these fines reduced or waived. And again, we are continuing to focus that judges and lawyers need to understand how the 415 should be implemented. Lastly, the school justice partnership was another aspect of the work that we focused on. Judge Corpening, who is our chief district court judge of all the chief district court judges, leads this effort. But again, Judge Parker is also on the school justice partnership with Judge Corpening, and she was able to bring him to us, and he discussed with us the work that the school justice partnerships are doing throughout the state. School justice partnerships are a group of community, are groups of community stakeholders in each area. This includes school administrators, law enforcement, court system actors, juvenile justice personnel, and others. They seek to develop and implement effective strategies that would address student misconduct. And this group in particular has worked to reduce suspensions, expulsions, and referrals to the justice system. So the Judicial Committee believes that the school justice partnerships have a proven record of success and should again continue to be implemented across all the counties in North Carolina. Any questions? I'm happy to take. Yes.
Did Judge Corpening give you sort of a number of where we are now on the school justice partnerships in terms of how many counties have them? Do we know that yet?
I'm not quite sure, Judge Parker, do you
I
recall?
sent that information. I talked to Ms. Howard. I think still at 65 counties, and you have, I think it's like 102 several counties that have multiple school systems. So we're still working hard, but I think we're at 65. And I can check that, but that's what I remember the last count.
Thank you.
Yeah, just on that question, it used to be that the Administrative Office of the Courts had on our court's website, a section about school justice partnerships with a map of where all of them are. And I don't know if it's been updated, but it seems to me but I don't know if it's consistent with if they're updating it, in other words.
I am not sure. DeMaka Adams, she handles school justice partnerships, and I can ask that question, but I know that she regularly presents, and she's still working hard to try to implement school justice partnerships across the state. Again, I don't know if she updates that map on a regular basis, but I can ask that question.
Because it seems to me that would help make public that information and continue to show the vitality of that program. Anyone else from the Judicial Committee? Well, thank you for that report. So now we turn to the Local Policy Committee.
So yeah, I'm Mike Hawkins. I'm chair of the Local Policy Committee, and our local from the very beginning, from beginning 4 years ago, we felt that a big part of our role is outreach to take the TREC message across the state, because we found that once people learn about the very reasonable and common sense kind of recommendations that came from TREC, the more people learn about it, the more they're in favor of it. And so our mission, we've seen, has been to go out and try to hit every county if possible, some people in every county, whether it be elected officials, whether it be nonprofit leaders, whether it be advocacy group people or members of the general public. And so we continued that this year in 2 or 3 different ways. One being, well, first, let me go back and say, I will begin by mentioning something this year that we were not able to get across the finish line, but was still nonetheless a very important and worthy attempt. And that is thinking about this outreach. We thought that a good project for this year would be to simply try to map and identify all of these various advocacy groups around the state, the local advocacy groups, thinking that if there was an evergreen kind of one location source for that information, it would be useful not just for TREC, but for other organizations, not just this year, but moving forward. We worked really hard on that. Thanks to Kerwin. You know, another thing about the local committee is we don't really care if you're a member of the local committee or not. We're going to ask you to help. And Kerwin gave us a huge amount of help with that. We did a lot of work on it, and there's work that is there. We would like to continue that. Hopefully, there's some iteration in the future that a group of people might be able to continue that work. So we weren't able to get that done, but there are other things that we did get done this year. We continued that outreach program, thanks largely to Preston Blakely, who is the mayor of Fletcher, a member of the local committee. Preston took that under his purview. And we did a number of presentations, mostly, well, entirely actually, to local elected officials this year. This afternoon at 1 o'clock, we're going to make a presentation to Latino leaders, Latin leaders across the state. They're coming to this room, and we're going to make the TREC presentation to them. Thanks to Bernice, she's the one who's organized that. And that's an example of the kind of outreach things that the local outreach that we've been working on. Another initiative that came out of local this year that really came to fruition this year, it really started last year or maybe 2 years ago, is what we're going to have a presentation on today, the Culture Project. That came about again because just like local doesn't really respect boundaries in terms of membership, we'll grab anybody. We also don't necessarily, we look at things and say, well, this may not necessarily fit directly into a particular TREC recommendation, but it's something that's worth looking at. And I will let Dr. Lopez talk about it, but it's a very useful and interesting conversation, our initiative, the culture initiative that you're going to hear about. The Law Enforcement Advisory Group was something that Jasmine started way back at the beginning, and the intent of that is to bring together law enforcement professionals from across the state, law enforcement leadership professionals from across the state, sheriffs, chiefs, other members of other leadership law enforcement people, and talk to them about TREC recommendations, get their input, have discussions, have conversations with them. It's been extremely useful. And I tell people that my experience with TREC, probably certainly one of the highlights was every month to begin with, and then the past couple of years it's been every quarter. Hearing the various law enforcement professionals talk about the issues of law enforcement in North Carolina, and just seeing how dedicated they are and how thoughtful they are. And Sheriff Burkhead is part of that. Lieutenant Garden's part of that. Director Smythe is part of that. And that's been really, on a personal basis, that's been really rewarding for me. I would add one more thing, well, two more things briefly. Another thing that came about this year, we added to our presentations, we asked someone if they would be willing to piggyback with us on our presentations, and that is Cindy Carvelis, who's a professor at Western Carolina University. Cindy and a couple of her colleagues at Western, on their own, looked at this issue of alternative 911 response, and they have developed a program to assist law enforcement agencies, smaller law enforcement agencies, and it began in the western part of the state, with this whole concept of can we engage, can we take some of the burden off of law enforcement with some of the response needs? Are there resources within the community that can be used for some of the responses or some of the calls that they get? And so Cindy has been coming with us on our TREC presentations, and through that, they have been able to expand that program, which is a really, really exciting and useful potential kind of program for all of North Carolina. So I guess I would close by thanking, but you have to mention the members of the committee, the board members, but especially the staff, Caroline and Brandy and Sherry, who had Law Enforcement Advisory Group dropped in her lap and did such a wonderful job with it. Ashby, and then also people like Greg Sabin and Ellen Spolar and Natalia, but most especially the work that Jasmine's done. At least from the local perspective, 90% of any success that we've had with local has been because of Jasmine, and I wanted to thank her. Any questions? And the other 10% is not because of me. It's
Well, I have a question. If no one else does. My read of the last, relates to the Law Enforcement Advisory Committee. And I second what you said about the value of that, getting that input and that perspective and the kinds of discussions. And I feel like that we were somewhat value add as well, back to them in terms of bringing some research and information and getting them things that were useful to them. I sensed from the last meeting that there was a will and a desire to continue working with whatever this might look like going forward. And I wanted to check and make sure that you agree that that's.
It is so valuable. It is so interesting and so useful. And yes, I would hope that it would continue. Yeah.
And then I did also want to ask about that. We had for a while a victims advisory committee, and I can't remember if that was the local. I think it was the local committee that. Yes. And so, do you want to just say a word about that? Because I'm not sure everyone's aware that we had that.
And that.
Yeah. Mike, I could speak on
Go
it.
ahead.
I actually started on TREC on the victim advisory committee for the first, I think it was during the second year of the first iteration of TREC. And I, of course, was there as advocate, but we had on the committee a number of impacted individuals, domestic violence survivors, human trafficking survivors, and sexual violence survivors were on that committee, and that committee has not gotten together during the last 2 years, but we did do a lot of work during the second year of the first iteration of TREC. What we did do was we would listen to many of the presentations from folks that the local committee would bring to us. And then we, as the Victims Advisory Committee, would ask additional questions and then give our viewpoint to the staff. And again, Jasmine was a great assistance in helping many folks. Again, I was an attorney on the committee, but most folks on the committee were just folks in the movement because they were impacted. And so the impact of the staff assisting folks just to understand what are these things. In particular, some of the prevention programs. I remember there was prevention programs that were highlighted from Greensboro that did a lot of good work. And at first, I remember some of the survivors were like, I don't know. But then as more explanation was given, folks were able to buy into the idea. So I think being on that advisory committee also highlighted the importance of education and educating the public broadly about these different concepts, because sometimes people come in with preconceived notions about ideas, especially when they've been negatively impacted by the system. But then once they are given a broader view, they can actually see how it can positively impact their life.
Thank you.
And if I could, I also, with that committee, I didn't mention Holly Jones, and Holly Jones was along with Angelica Wynn, who was a task force member, really spearheaded that and did a great job. Yeah.
Yes.
I just wanted to add that as we go forward, that either if this committee or some iteration of the people who are doing the local policy work continue, or if this can segue into the reentry work that will be going forward, wherever we can find a place for it, it would be helpful if we could have a checklist at the local level, a simple checklist that might help advocates and community members know what are the best practices for racial equity and criminal justice in our local community. Do you have a school justice partnership? You know, who's in charge of that? What are your do you have use of force policies, both for law enforcement and incarceration or whatever other diversion and mental health? You know, are there 10 things everybody needs to know? And if somebody is interested in creating that, that would be really nice. Or maybe there's already a version.
So there's not quite,
Yeah, please.
There's not quite a checklist, and I love that. But there is, I think in the first year post report, we put together different categories of recommendations. So there is a local, essentially the recommendations that were assigned to local in the first place. But I think as this is going on, we have realized that there are places where it might actually be technically assigned to another committee, but it could be implemented at the local level as well. So I think there's some raw materials there that could be pretty easily turned into a checklist.
And
something fighting over what should be on it.
Yes, something bite-sized. Yeah, that for local people. And I only mention it because some of our projects that I'm advised to, like NC Fit at UNC, one of the things they raise is that for them to go into communities, there has to be a certain infrastructure. It's helpful if there's a certain basic infrastructure there around criminal justice reform. But, we talk this lofty language, but the average person will be looking at them and saying, well, we can't, what do you mean? Infrastructure. And there's no really easy, and then they try to tell you, but, there's no easy list and then a language that people can start learning in terms of what's essential would be helpful.
Well, thank you for that report and for the discussion. I want to just, at this point, ask if there are any other reports that anyone wants to make about any of the work. And I'm kind of looking at Kerwin because of the reentry work that you, the organization that you're now a part of as TREC's representative. And I don't mean to put you on the spot, but is there anything you want to tell us about that work that you can update us on?
So you kind of did put me on the spot.
I know.
So the Joint Reentry Council 2030 has done some amazing things. The report just came out. Our end of year report just came out. We was able to put, I think, DAC set aside several $1 million to create additional local reentry councils across the state. My organization created a call center database people can call in for reentry services across the state. And it's some more stuff, y'all. Y'all go look at the report. So put me on the spot, so I won't really prepare it, but we are doing great works and we look forward to carrying this initiative out to 2030. And so look forward to, partner with the new administration to make sure these initiatives surrounding reentry get carried out. And so we created a robust plan of different things we hope to accomplish by 2030, reducing homelessness with justice impacted, justice involved individuals, signing them up for Medicaid expansion, just a plethora of different things in the reentry world. So please go look at the report. It's more detailed than what I am now, y'all. Thank y'all.
So that was really helpful. Thank you. Thank you for that. So I think unless there's other questions, oh yes, please.
I have a question. Can somebody give us a kind of a brief update? Maybe Secretary Buffalo on the Office of, I think, Violence Prevention. Where are we with that office? I know it was one of our important recommendations.
Sure, I'll start, but I'll yield to Chief Deputy Secretary Hoekstra, or you want me to yield to Deputy Secretary Fallon? Cool, I'll put you on the spot.
I'm really excited, and it's included in our year-end report on some of the progress that's been made by the Office of Violence Prevention. They have, tripled in size from 1 to 3, 3.5 actually, and hopefully in 2025, we'll be adding a 4th person, which is going to really allow us to do more outreach and support at the localities. You heard me mention in 2024, we were a little bit caught off guard and unprepared for the number of inquiries we got from localities that we didn't have the capacity to support. So we are growing to do that. We were able to secure a grant working with GCC, the Governor's Crime Commission, to help us fund some of that. That same grant also helped us host a North Carolina first time inaugural Office of Violence Prevention conference here in Raleigh. We were thrilled with almost 200 participants, including representatives from the White House Office of Gun Violence Prevention, the National, oh my goodness, all these acronyms, National Organization of Criminal Justice Reform, and several others that were speakers and participants. We had participants from all over the state. We were thrilled about that. A special shout out to the advisory group. Some of the representatives are here of OVP, which did put together, and it's available on our webpage, the strategic plan. And we're going to be working on, starting in 2025, the implementation plan now that we have the strategic plan and how we're moving forward on that. So really proud, thanks to the Secretary's support of a lot of, key, foundation building and efforts at growth in about less than 18 months. So we're pretty excited for how it's going. We hope it's continued to be supported through the next administration. We've got some budget ask of the General Assembly, and would love to be codified in statute to create some permanence, and we'll keep working towards that.
Thanks. Thank you.
You're welcome.
So I think we're at the point now where we can turn to the report on the culture project findings. Dr. Lopez? Oh, sorry. Was there another question?
Representative Moore was going to get the legislative.
Oh my goodness. Thank you. No disrespect whatsoever, I promise. Please.
Disrespect to the legislature?
None.
We can move on. Hey, everyone. Yeah, Senator Mohammed is the chair. He isn't here. I'm channeling his urgent email to me to give his report. So I apologize. I'm reading his email. It's pretty much in the report on page 30. Members of the Legislative Committee are Senator Mohammed, Chief Jennings out of Charlotte, and Brandy has been there, Caroline's been there, I've been there, and it's been a challenging session to work with the legislature, to say the least. But there are some highlights. And during a planning session, there was an agreement to partner, do more work with the Conference of DAs, Department of Motor Vehicles, legislators, staff, and chiefs of police. And we did a lot of collaborating, looking at driver license restoration legislation, which was good work. Also say not only legislation, but law schools are starting to get interested and having clinics. And with the cooperation and support of Department of Adult Corrections, they're going into prisons, students, and helping people incarcerated look up their driving records to get ready to have their license once they're released. And it's a big help. Other law students across the state are getting interested. So I really applaud the department and interested students doing this. It really is a big help. There was another panel discussion in November, and it was on gun storage and violence prevention. And on the panel was Sheriff from Guilford, Danny Rogers, Von Dockery of Father's Genesis, whose son was tragically killed last year from an unsecured firearm, Mark Gooden, who is with Injury Prevention, and Senator Applewhite. Great conversation. We did introduce safe storage. It did not get a committee hearing, but we are going to keep trying on prevention of gun violence. Other than that, I would say a lot of our conversation revolved around what was happening, what legislation was being promoted, what we were kind of on the defensive on with our 125 original TREC recommendations. It is very challenging, as Sheriff Burkhead knows very well, who came over, and we had a lot of contention about the ICE bill. about the detainers that now has become law. The rioting bill, which is, we've done a lot of past bills that increase criminal penalties. That does have an impact when we look at our TREC recommendations. And also, as you know, the raise the age that we were very proud of passing. It has been chipped away, and just effective December 1st, 16, 17-year-olds charged with felonies no longer have to go through the juvenile justice system. They now be directly charged and indicted in the adult system. We're worried about that. You look at the data, we're very worried about that, but we will do our best to collaborate, to get more conversations with the Conference of DAs, who has a very strong lobbying effort at the General Assembly, as well as the sheriffs. And but we can do it. This is not political. You know, it's about what is good for our state, what is good to address racial discrimination and achieving better racial equity. The only other thing I'll say that was not out of the legislative, but it does apply to a lot of what Kerwin said, what Judge Parker's done, what Angela knows about, is this Juvenile Sentencing Review Board. We met for 3 years. We met 25 times. Last week was our final meeting probably, and the governor was there. But we reviewed over 200 cases. And these are cases of people who, before they were 18, were sentenced to more than 20 years. Many were sentenced to life in prison. They've had Miller hearings. It's been reduced to life with the possibility of parole. Many of these people who are now in their 50s, 60s, 40s have been in way over 20, 30, some 40 years. One case we reviewed was convicted at the age of 13. The youngest in the country to still be incarcerated after 35 years. A petition came from Brian Stevenson of Just Mercy on his behalf. These cases are incredibly important. And a big thing that the Juvenile Sentencing Review Board does to recommend clemency for the governor to consider is reentry. How solid of a plan would there be if the governor did recommend reentry? So this effort and the executive order he implemented are so important for these lives. But we really appreciate the hard work of the governor's clemency office, my colleagues, on the Juvenile Sentencing Review Board. Mickey Michaud was on it, Allison Duncan, former federal judge, is on it, and Thomas Wallace, former U.S. attorney, was on it. And we worked very hard, and there's still a lot of work to do. We didn't get through all the cases. There are about 100 more to look at, but time was running out. But I hope we did good work, all because of the recommendation at TREC. So I thank you very much, Madam Chair.
No, thank you. And it's incredible the work that committee has done in challenging circumstances. And I thought the gun storage presentation was really impactful and important, and just all the work of that committee. So thank you. Yes.
I also just wanted to just bring back to the Judicial Committee one of the things that I forgot to mention, and give a major shout out to our staff. Assistants, Caroline and Laura, and Brandy and Elaine, sending those important emails. I do think I would be remiss if we didn't mention their important work. And again, Brandy was just and has been a great leader. And again, all of the things that we were able to do, especially the reentry work, I think would not have been possible without their relationships with all of the other letters, as Caroline likes to say. So yeah, I just wanted to make sure before we close out this section that we give a shout out to our staff.
Thank you. Yes.
I just wanted to real quickly make sure we don't miss this. The last time that we gathered as a full task force in person, we adopted a resolution in support of DAC allowing for dialogues between people who've been convicted of crimes and people who are in prison. And just recently, DAC did adopt that policy that will now be allowing people to come into prisons, have dialogues with people in prison. I think this is due in large part to the leadership of the executive committee. So I want to thank you all to Kara, to Lieutenant Garden, and everyone else on TREC who paid attention to this issue. It was highlighted by the governor in the reauthorization of TREC that we should look at increasing opportunities for restorative justice programs. And while this is not technically restorative justice, it is a restorative practice. And I think it's something that TREC should be proud of, that we're ending the year with that policy in place.
Anything else? Yes.
I want to make sure folks know this because this is a game changer. CMS just approved the 1115 Medicaid waiver. There's still some other hoops for that, but that's going to allow for a 90-day period for prior to release, and all 53 state prisons and youth correctional facilities and a subset of county and tribal operated jails. I'm not sure what the subset means. But includes basically having Medicaid 90 days prior to release, including care management, Medicaid assisted treatment, minimum of 30-day supply of medications in hand upon release, physical and behavioral health clinical consultations, laboratory and radiology services, medications prior to release, and durable medical equipment. So this to me is a really big game changer and can really support folks on reentry and may have, positive impacts on your budgets too. So.
Anything else? Well, thank you all for those reports and updates. And I do think if we went back and looked at the executive order that set up TREC 2.0, what we've just heard this morning is really encouraging in terms of the way that we have tried to address what we were mandated to look at. So thank you. So I do want to make sure that we have time to hear from Dr. Lopez. So I think we can turn to you. Do you want us to move from up here?
However, I was kind of trying to feel out where had the best acoustics.
Right.
But, I think we'll go up here.
And I apologize, I didn't do a proper introduction.
No worries,
Tell people-
totally fine.
Tell people about it.
I'll introduce myself.
Thank you.
My name is Jesse Lopez. I'm a researcher at the Wilson Center for Science and Justice, which is located at Duke. And I am very excited actually to talk about this project. Anytime I get the chance to, really am excited about it because it was actually the very first project that landed on my desk when I arrived at the Wilson Center about 1.5 years ago. I received a email with some draft set of survey questions that were going to be asked of law enforcement officers. And I was sort of told that we were asked to revise the questions, build out a survey, and then potentially conduct data collection. And I was like, all right, let's do it. I'm a big fan of surveys, so let's go. And we did end up building out a survey that covered largely 4 topics. And these topics include community relations, which was questions aimed at understanding how officers approach and their attitudes towards the community. It had a section on roles and responsibilities, primarily focused on enforcement. So it had questions asking which offenses they find most important for law enforcement to address, how open they are to non-law enforcement assisting and addressing some of these offenses. We also had a section on officer well-being, which had a lot to do with burnout and whether or not there were norms that support officer well-being at their agencies. And finally, we had a series of questions around misconduct and specifically around whether or not they had policies on use of force, pedestrian stops, traffic stops. We didn't want to just know whether or not they had written policies on these things. We wanted to know if you do have these policies, how clear are they, but also the attitudes and behaviors around those policies. So when somebody violates a policy, how likely is it that personal relationships will influence consequences, and also whether or not there are unspoken norms or unspoken expectations around these things that aren't in written policy as well. And so we built out those 4 sections, and honestly, there's a lot of questions in each of those sections. I could spend 20 minutes on each section, but I'm told I can't keep you a hostage here. So I'm gonna just present 1 question from each section. But what I want to first start with is, we have the questions, And what we ended up doing was we launched the survey between April and July 2024. And how we did that was we actually sent an email from Secretary Buffalo's email to chiefs with a survey link asking them to circulate the survey to their officers. Each link had a unique identifier, so we were able to keep track of like which agencies were actually providing responses and how many responses we were getting from each agency. So that allowed us to send out follow-up emails or make follow-up phone calls when we saw that an agency wasn't necessarily. And we did that until data collection ended, or they told us to stop bothering them. But in terms of how many agencies actually circulated the survey link to their officers, we contacted 333 agencies that we had the contact information for, and about 190 agencies had their chief actually circulate that survey to officers. So that's about a 57% participation rate there. But that's not how many officers actually participated. It's not telling you what percentage of officers that got the link actually took the survey. To look at that, what we were able to do was use census estimates of each agency's workforce, which we got through the State Bureau of Investigations, to estimate how many officers were at these 189 agencies that took the survey. There was one agency that we couldn't get an estimate for, so out of the 190 agencies that circulated the link, we were only able to estimate 9 of them. And what we found was that there were 8,855, approximately that number, officers at these 180 agencies, and we got back 1,600 officer level of about 18%. I want to make 2 points about this number right here. One, 18% might seem low, but I think in the context of the survey being completely voluntary, it's not mandated, it's not required, it's not part of their job. And also we were not providing any sort of incentive, gift card or anything for their time. They were just being asked simply to take time out of their day to take the survey. I think this 18% reflects the hard work of myself as well as Sarah, who's in the back there, who is also calling these agencies to try and get them to circulate or nudge their officers to take that survey. The second point I want to make about this 18% is that any of the findings that I'm going to share, I just want to qualify with saying that it's not going to be representative of all North Carolina law enforcement officers given the response. Okay? None of the results are representative of every officer throughout North Carolina. We can't say that sort of large of a statement, but I still think that the findings are worthwhile. There's interesting things to glean from it. And I also think that, and we'll touch on this at the end, we're going to be providing individual reports to the agencies that had high participation. So the ones that had like 50, 60, 70% of their officers actually participate. And for them, it is going to be pretty insightful because they had a large chunk of their officers answer these questions. I just wanted to make that point because again, it's 18% of the 885 at the 189 of the 333 possible. So it's not representative of all North Carolina law enforcement. But now that we sort of qualified the results, what did our actual responding officers who took the survey look like? Well, 80% of the respondents were white, 84% were male, 35 to 44 years old was the largest age group. 25 to 34 was the second largest. Our smallest age groups were actually that under 25 years of age and over 55 years of age. They both made up about 5% of respondents. In terms of where officers are at in their careers, 41% reported being in their current position for 2 to 5 years, while we have a sort of more varied response in terms of law enforcement experience. We had 24% report that they've been in law enforcement for 21 years, 21% report 6 to 10 years. And our smallest group was actually officers who said they've been there for a year or less. So it wasn't just the new kids who were willing to take our survey. It was a sort of diverse set of respondents in terms of. So now we have a sense of what the responding officers look like, and I actually want to start getting into what they said. And so I want to first start with questions from that community relations section. And these are questions specifically related to attitudes about the community. So we had questions about whether or not officers feel trusted and respected by the community, which have been used to assess feelings of external legitimacy or legitimacy of the community in past research. And we also had questions about whether officers feel the community understand an officer's role and whether they have reason to distrust the community. And what this has been used in past research to capture is a sense of and how we went about and asked this was we had these statements here and we asked, how much do you agree or disagree with the following statements? So that community trust statement, community members treat officers with respect statement, and then we had officers on my agency have reason to be distrustful of community members, and then the community doesn't understand what it means to be. I want to make a quick point about why these last two statements are in red. It's because we're going to be focusing just on the percentage that say they agree with these statements. And for the first two, what we hope to see is like high percentage of agreement, right? We want officers to feel like the community members trust and respect them. So we're hoping to see a high percentage of agreement there, right? But when it comes to these last two, I think in an ideal world, we'd want to see like low. So they have reason to be distrustful of community members, and we want them to feel understood. And so what we end up finding is for that, distrustful of the community statement, the one that we're hoping has a low percentage of agreement, we actually find that it's 31%. And a lot of that is driven by that blue bar there. So it's a somewhat agree. So it's not very strong level of agreement with feeling they have reason. Then for the trust and respect questions, which are the second two bars here in the middle, where we want to see high levels of agreement, we actually do see most officers agree with those statements, right? About 80% are trusted and respected by the community members. But then for feelings of being misunderstood, we also see that most officers feel agree with that statement. And about half of that is actually strong agreement. There's a pretty strong sentiment around not feeling that the community members understand. So most officers have low feelings of distrust towards the community. They do feel trusted and respected by the community, but there is this feeling of being misunderstood. So it's sort of a nuanced sort of picture a little bit. Then for the next set of questions I want to share, they come from the roles and responsibilities section, and it aims to understand how open officers are to having non-law enforcement come in, lead, and support when it comes to addressing certain issues. And I think this is important to find out because it gives us a sense of how possibly viable alternative responses might be from the officers' perspectives and how much there might be immediate sort of buy-in. And what we did was we asked it in the following way. So we had this statement here. There's growing interest in having non-law enforcement, such as social workers, mental health professionals, or community services support law enforcement or even lead the response to certain issues. Which of these issues do you believe non-law enforcement should lead? And they could mark any of these. So they could mark public nuisances as well as possession of drugs in small quantities, or they could only mark minor traffic infractions, or they could mark none and say that all of these issues should be exclusively addressed by law enforcement, indicating a sort of lack of openness, at least when it comes to these issues being addressed by non-law enforcement. So what we found is that 31% of officers actually marked that none option. So and felt all of these offenses that were listed should be addressed by law enforcement exclusively. So a sort of lack of openness when it comes to alternative response or non-law enforcement involving themselves in these issues. But we also see that there is pretty sizable support for some issues. So for example, nonviolent homeless incidences, 46% of the officers marked that they'd be open to non-law enforcement coming in and assisting or leading when it comes to these things. Public nuisances and nonviolent interpersonal disputes, both of those hover around the 40% mark. So I think it's sort of a nuanced sort of picture. Yeah, we have 31% marking that all of these issues should be exclusively addressed by law enforcement, but then there's also this sort of, it depends on the issue in terms of. Then the next set of questions I want to focus on are burnout. We asked questions that focused on 3 different areas of burnout. So exhaustion, which is feelings of being emotionally overextended or exhausted by work. Cynicism, which is feeling unfeeling and impersonal responses towards people who you're serving, so community members in this case. And then professional efficacy, which is feelings of being competent and successful in achieving things. And the way we ask this is how other researchers have asked these burnout questions in the past. We asked, how often do you have the following experiences in your role as a law enforcement officer? And we had 2 statements for each of the different aspects of burnout. So for exhaustion, we had, I feel emotionally drained, or I feel used up. For cynicism, I feel more insensitive towards people. I worry that my job is hardening me. For professional efficacy, we have, I feel accomplished, or I feel I'm positively influencing other people through. And what we're going to look at is specifically at the people who feel these things frequently. So, or highly exhausted, or highly cynical, or have high sense of professional efficacy. And how we're going to do that is we're just going to focus on the people that say at least once a week to both of the statements. So for example, if we want to look at the people who are high in exhaustion, those are people who have said either once a week, a few times a week, or every day to both of those statements there. So they said at least once a week to both of those statements to be. And what we find is about 38% of the officers that responded experienced both signs of exhaustion at least once a week. 30% experienced both signs of cynicism at least once a week, but 48% experienced both signs of efficacy at least once a week. And I think you can, I think people can have different reactions to these percentages. In my mind, I think feelings, these aspects of cynicism that were listed at least once a week, I think 30% is a notable percentage of people. Feelings, right? Exhaustion, 38%. But then we also have half of the responding officers feeling like they are affected, feeling like they're making. So again, sort of a mixed picture. I wish it was like a straightforward, sort of clear image, but I think there's some nuance here. Then I want to get to the misconduct policy section. Specifically, this question, we were trying to understand how clear an agency's written policies are when it comes to use of force, pedestrian stops, and traffic stops. And how we did that was we asked how clear are your agency's written policies regarding when and how officers engage in vehicle stops, pedestrian stops, use of force beyond handcuffing. And what we're going to focus on is specifically the percentage of people who say very clear or extremely clear, because we're really trying to figure out, like, are these like very clear policies? We don't want it to be moderately somewhat or not at all. And what we find is that across the 3 areas, it's pretty similar. Most officers are saying that these policies are very or extremely. It is varied slightly in the sense that pedestrian stops shows the like lowest percentage of respondents saying very or extreme here at 77%, whereas use of force is all the way up at 87%. But again, still across all 3 of these areas, most officers are finding that the written policy on these things are very or extremely clear. And then for this question, we wanted to sort of get at understanding whether officers feel the disciplinary processes and consequences for violating those policies are impartial. And the way we tried to get at this was asking, how often do personal relationships influence consequences for officers who fail to follow those policies on vehicle stops, pedestrian stops, use of force beyond handcuffing? And what we're going to focus on is that percentage that say never or rarely. So personal relationships never or rarely influence consequences. What we see again is across these 3 areas, very similar sort of percentages. We're seeing a majority of officers say that these things never, personal relationships never or rarely influence consequences. 56% for vehicle stops, 61% for use of force beyond handcuffing, and 58% for pedestrian stops. So again, a majority across all of these areas, but I will say on these sort of like, you can take that number or you could like flip it and you can see for vehicle stops, it's like 44% say that at least some of the time personal. Right? So there might still be something worth digging in there. And then in terms of, so that's all the sections. Again, only about 1 question per section because I keep you here all day if I really can. But in terms of what's next, all of the agencies that participated are going to receive an aggregate report with these results, sharing insights from them. Individual agencies that had at least 50% participation are going to get individualized reports based on only their officers' responses accompanying that aggregate report. And again, we only are doing it for those that hit that 50% threshold. Because of the fact that, again, we don't want to send an agency individualized report based on 3%. And then but for those agencies with less than 50%, we are going to be grouping responses by the size of the agency and still providing them with a report that's a little bit more, trying to get a little bit more individualized for them, right? So agencies with 10 or less officers, that agencies with 25 to 50 officers, those are going to be the size-based sort of reports that we get. And there will be, like, if an agency gets that report and they're like, oh, I really wish I could have like encouraged my officers to take it more. There's like a lot of interesting things here. There will be some contact information on the report telling them they can reach out and potentially re-administering. And then Wilson Center is actually looking at the relationship. So these are all very descriptive results. This is what they said to the questions. What the Wilson Center is looking at now is relationships between the questions. So one of the things we're going to look at is the relationship between burnout and openness to non-law enforcement responses. And it's a sort of like quick sort of insight to what we're finding. High levels of burnout are related to openness to more non-law enforcement responses. So it seems to be that, at least on the surface, just at a quick glance at things, that those officers who are experiencing high levels of burnout are actually looking to offload some of those duties and getting in some more support on law enforcement entities.
Have you had the opportunity, that maybe you're not this far along, to look at individual agencies that reported, and have we been able to discern one that was particularly positive or the opposite, particularly negative?
So just identifying a specific agency that's.
Or
really
is there a
positive.
geographic trend or a trend between large size agencies and small size agencies?
Yeah, so we haven't necessarily looked at that. I think that we've broken a lot of the responses. Again, for the size-based report, we had to break out things by size. And I didn't see anything that stuck out. I think there were definitely some trends, and I should have like noted this for this, but there were definitely some differences across agency size when it came to burnout. But off the top of my, I don't want to give the wrong answer here. But yeah, there were some differences by size, but I haven't looked at like, oh, this agency was particularly great at this thing, or particularly bad in terms of this.
I mean, we would like to emulate. I mean, if there is an agency that just is off the charts and their officers are feeling positive and contributing, we certainly would like to replicate that.
Yeah.
Any other questions?
Yes.
I have a question. What region or part of the state did you receive most of your responses from? The people who did respond, what region and what part, and what region and part did you not receive like majority responses from?
I haven't done it by region. We haven't looked at like response rates by region. I will say that the participation rates at agencies that had like fewer officers were pretty high. I don't know if that gives any indication of the region. Like maybe like officers are like more located in rural areas or something like that. But I have not looked at geography or region or anything. The only thing I can say off the top of my head is about that size, and agencies with fewer officers tended to have higher participation rates. So bigger agencies with 100 plus where we really struggled to get officer participation.
For the group, I'll just share as a former police chief, I could get as many as 3 emails a week asking for my staff to do surveys. So some chiefs just shut them down. No, we're not doing any. Officers get burned out on doing them, especially the bigger agencies have a much bigger churn. And so a lower response rate from those big agencies are really on the radar to participate. It's a very delicate balance to evaluate which surveys you're going to push and which surveys you're going to trash.
Yeah, we did some pilot testing at an agency that I'd say is fairly large. And then I did interviews with the officers after just to make sure they were understanding the questions correctly. But one of the things that they were like, I wasn't anticipating was like me doing the interview after they took the survey a week earlier, they would go, which survey is this again? So like, there's definitely, I think, especially among larger agencies, they're just.
Is there a way to reach out to those chiefs and the sheriffs who participated, when you send the results back, to get their feedback on the results? That is to say, I mean, like the slide that you had with the clarity of policy question, and like use of force was like something like 85%. Yes, I understand it. So is it good that 85% understand it, or is it bad that 15% don't?
Yeah, I mean, I think that is a sort of tough thing to define there. I would say like having 85% understand very or extremely clearly the written policy is a positive thing, especially because like there is probably some of that 15% that falls into the moderately. And definitely there's still room for improvement. In terms of getting feedback from the chiefs, would you be thinking like, because we haven't sent the reports out yet, would you be thinking like actually collecting their reactions to the reports or the findings, or?
Yeah, and again, just speaking as a citizen who's not versed in it, just the question that I ask, to provide context to the answer, to say, okay, 85% understand it, do you think that's good? Are you happy with that? And you always want it to be 100%, but is that within what you would have expected?
I think it's I mean, me personally, like I think it's probably higher than I would have expected. Written policies can be kind of dense and complex, at least when I them. But again, I'm not in the law enforcement field myself, so I have no sort of gauge for that. I do think each chief will probably react differently to it. And you know, we did have so they weren't included in any of these results, but we had about 160 of the 190 chiefs actually fill out the survey, even though we didn't ask them to. I think they just took it. So I do think that they probably have their own assumptions about how clear these policies are. And so when they see the result, they're going to have their own expectations about probably what their officers are going to say to these things, probably have their reactions. And if it's not in line, my expectations, they probably will make some sort of like adjustment and like make them more clear.
So I think we have time for one more question, but I wonder if I can ask our panelists who have come to join us to come to the front while you're answering this last question, if we can.
Hey, thank you for an excellent presentation. I just was wondering if you had any sense of the baseline. You mentioned that 80% of the survey respondents were white and 84% were male. And I was wondering if you know what that compares to among like who could have filled out the survey?
Yeah. So I got this question last time too. Jeff Smith, you always ask me the question, and we are working on it. So you're also at the Wilson Center. I see you through out the Wilson Center building. So I believe you know Ben Grunwald, right? So I've been trying to get Ben Grunwald to provide me with. He has like data on the demographics of officers that I don't have and necessarily understand how to use that easily. So I'm hoping that he can give me some benchmarks for demographics so that we can actually compare, like, you know, is it reflective, not representative, but does it approximate like how white the North Carolina law enforcement officer population is generally? Like, how much do we approximate those demographic benchmarks? I have not done it yet, but yes, we are trying.
Thank you. Well, let's thank Dr. Lopez. I really appreciate that. He did an amazing job keeping it to 20 minutes when we really should have given him a whole hour to tell us the results. So next on our agenda is to hear from some amazing community advocates. And I promise you, I had planned appropriate introductions for them because they certainly deserve it. But in the interest of time, I will let them tell you a little bit about their work. But we are really fortunate to be joined by Letha Muhammad, who is Executive Director of the Education Justice Alliance. And she will tell you what she's doing, but I have to brag on her to say that she's got many awards, including in 2021, the Grassroots Empowerment Award from the North Carolina Justice Center. Next to her is Philip Cooper, who came to be with us from Asheville today and also has received many awards. He is founder and chief change agent of Operation Gateway, Inc. He's also an awardee of the North Carolina Justice Center. And Judge Thornburg, who wanted to be with us today, when he heard that Mr. Cooper was going to be presenting, said he's amazing. So definitely an endorsement there. And then Robert Dawkins has come to be with us from Charlotte. He is with the SAFE Coalition, again, recognized by his community many times, including being a 2019 Charlottean of the Year. So some amazing folks to be with us, and I'm going to ask them a couple of questions, but we had hoped that this could be interactive. So please feel free to ask questions and make this somewhat of a discussion. But I want to start by asking each of you to tell us about your work and how it intersects with the task force mission of reducing racial disparities in the criminal justice system. I'm not sure where to start. You want to?
I can go. Hey, good morning, everybody. I am, like she said, Letha. I use she, her pronouns. First and foremost, I'm a Black mama of Black children who attended public schools. And that's what puts me before you all today. I don't go anywhere without naming that important honor that I have. So my work at Education Justice Alliance is really predicated. Our mission is to dismantle the school to prison pipeline and the school to deportation pipeline to end the criminalization of Black and brown students, students with disabilities, students who identify as LGBTQ+, in our public schools across North Carolina, and to fight for educational equity. So that's a mouthful, but in a nutshell, the work is really, our work is predicated in building deep relationships in communities with working class Black and Latinx parents and young people, helping them understand their rights as it relates to how they interact and show up in our public school system, and to fight for a school system that actually allows them to fully show up as themselves, or they're Black students or Latinx students or LGBTQ+ students. I think the way my work intersects, right, is that we have a problem, and this is a long-term problem that we've had in North Carolina public schools. I've been doing this work at least 12 years, and it's really around the ways in which young people, and those young people I've already mentioned, are disproportionately impacted by suspensions, expulsions, and referrals from law enforcement out of schools. And so research tells us that the first time a young person is suspended from school heightens their chances of being suspended again, and then funneling them from schools to the juvenile or adult criminal justice system. So my work is parallel to the work of this task force, and I'm happy to be here on, you all's last official meeting day for this iteration. But my hope is that this does not stop, that our incoming governor-elect will see the importance of the work of this task force, and that there are opportunities to keep the work going, but then also to engage community folks like me at this table from a particular focus around the school to prison pipeline and schools.
Good morning, Philip Cooper, and I'm glad to be here. And it's tough the holiday season because I lost a daughter in January, and so this is the first holidays we got, and I named that because one of the things that I'm most passionate about is behavioral health justice and like mental wellness, mental health. And when we think about the word equity, equity it can be politicized, right? But when we think about the word equity, we have to think about access and impact. Everybody say access. Access. Say impact.
Impact.
Okay, great. Good morning. And so as far as what that looks like with Operation Gateway and what that looks like with my personal life, I have to utilize the resources that are available to help me be well right here. You can give them a job, you can give them housing, you can give them all kind of things, but if they're not right mentally, they will not sustain it. And so with Operation Gateway, we look at decreasing recidivism by addressing social determinants of health. And, one of those is access to education, access to, healthcare and mental health is health. Everybody say mental health.
Mental health
Is health.
is health.
And so we can't afford to forget about that. You feel me? Because a lot of times people get into the criminogenic activities because they wasn't right mentally. They go self-medicate, right? And so how what we do at OG aligns with the solutions. I look at some of those solutions and we're talking about access. We're talking about resources. The 115 waiver, thank you for bringing it up, my brother. That is major, right? And we look at how do we access the individuals that are incarcerated. We have to look at new ways of doing things, and at Operation Gateway, we had to figure it out. And I come from working inside the system. We have to have change agents inside the system, and you have to have change agents outside the system. I'm the kind of guy, I'm calling out violent inaction no matter what. So that means I don't need to be working inside the system, right? And so I had a very tough time working inside the community college system, working inside the justice system, working inside the behavioral health systems, because I was working inside and I was like a bull in the china shop. You dig? Any of y'all got toddlers in the house? You know how it is whenever you got something that you don't want to get knocked off and it get broke. Well, whenever I was working inside the system, everybody was watching me. If you seen Philip walk in the room, they go, oh, hell, what are you gonna do? You know what I'm saying? And so what I ended up doing, I worked inside the workforce board, and I transitioned into finding a nonprofit that could really work on those local level. I heard a sister over there say something about local level, local communities, and translating messages to those local leaders. And so that's what we're doing right now, and I'm just glad to be here.
And I don't even know how to come behind that.
Right.
So my name is Robert Dawkins. I'm the political director for Action NC. And we're a member-led organization, and we work on issues like affordable housing, police accountability, neighborhood violence, anything that impacts low to moderate income neighborhoods. So there's two sides to this. And there's the organizers that work, and they're going to be working on more of the aggressive ideological, we're going to lay down in front of a train track and we're not going to stop until we do blah, blah, blah. And, I've done that for most of my career and I appreciate it. But now that I'm older, I'm on the political side. So as political director, I look for more of the practical, what can we do solutions while still supporting the ideological thing. So during the, mid 2015s, we were at a real impasse on both police accountability and neighborhood safety. And people were trying to make people judge between the two. Which ones are you going to work on? Police accountability and neighborhood safety. And my point is that they're interchangeable. Both of them have some different ways that they need to be approached, but I think we can work on both of them. So we had started looking before the task force was founded at different models that we could do to replace police interactions with people. Because if you have less interactions, you have less calls for service, then you have less chances of bad interactions and police doing things that they don't have to do because you've assigned those tasks to somebody else that's more able to do it. And when we presented it in that terms versus defund the police, we did get some doors open. So we were able to sit down and look at things that we could do to address this as that issue. Now, I go back the next day on some of my more ideological issues and the door gets slammed in my face. So it just depended on which way we were coming on whether I was good or evil that day. But about this same time, Charlotte, we had started looking at models that we could use for violence interruption. And Cahoots was a model out of Portland that we were really, we really did love it. But couldn't get much of buy-in from the city because the city's used to doing what the city's used to doing. And that's giving small groups of people, small pots of money to go out in the community to address it. And even though it's great on the emotional side, you got a cake, you got a balloon wreath, you got a couple of T-shirts. We're going to sign up and we're going to try to do a little work together and that dies out. It still doesn't show evidence-based methodologies, which is what we were pushing the city to do. So instead of just keep handing people the same money to make the same T-shirts, let's put the money and invest it in something that'll actually work. So about that same time, COVID hit. So when COVID hit, all of my members was looking for what can we do, what can we work on? The blessing was the task force was here. So the task force helped on these issues for us because now I couldn't be out knocking the doors. So working through an attorney friend of ours, Jake Sussman, Jake was making sure our members were writing letters to the commission or getting in on the Zoom meetings or whatever. That made them feel empowered. But what it also did was when your recommendations came out, it helped be a ceiling point for Charlotte, who is progressive to some extent, but fiscally conservative in another extent. Strange living in Charlotte, but that's a separate question. What having the legitimacy coming from y'all based on our coalition saying, hey, we've been calling for this, I think was some of the deciding factor for Charlotte moving forward with some of our suggestions. So we took the cahoots model of going into the neighborhoods and doing mental health services providers as opposed to police. Charlotte said we would work on that. And we raised enough money from the city's budget out of some ARPA funding to assign that and get the pilot program going. And it showed some success. Simultaneously, we started working on our violence intervention work, which we modeled after Cure Violence. Well, yeah, you can't actually model it after. That's another thing with Charlotte. We tried to do it on our own, and Cure Violence said, hey, we'll go to court on that. So we'll just bring in cahoots and work with y'all. So that led to our Alternatives in Violence program, which has been around now for 2 years. That we premiered in 2022, and we've gotten reports back for 2023. Numbers look good for a city like Raleigh or Charlotte. And I say that because cahoots is usually in large cities. So you'll look and you'll see in the course of a year, Chicago had 700 interactions. And Los Angeles, it'll be 1,400 interactions. In Charlotte, it's more like 200 interactions, but we're not as dense. The pilot program area was small, but it was enough for us then to go and lobby. Of course, using Jake again for Jake Sussman to go out and lobby. I think with the help of Ms. Earls, talking to our Congresswoman, Alma Adams, there was pots of money available. So we were able to get enough money, I think it was $1 million, to take the program from one pilot neighborhood into 3. So now the program's been out since 2023 in 3 neighborhoods. I think when we see the numbers, they will be good. The way that the city funded it, Congresswoman Adams was able to give us that $1 million to start those other 2 additional programs, but there wasn't funding for the pilot program. So we had to work to get an extension in the budget to keep the first pilot program going. So that's where we are now, waiting to hear back on that. So that was 2 suggestions that we worked on specifically from suggestions there. And we had another suggestion that I don't know if that was one of yours or not, that we put out there, and Charlotte did bite on it. And that was replacing police officers on traffic stops with civilian troops, which just started in Charlotte 2 days ago. Took a while to really work out. This took a couple of years of who was going to be, I guess, bonded, whatever. But those were 3 suggestions from your task force that, I think the fact of having so many academics, having people like Sheriff Buckhead, having all these different people on there, because our police chief was pretty admirable to it. He was like, I think this is something that cuts down on negative interactions on both accounts. He thought that while the police are also doing their own thing in what's called CIT, where they have clinicians go out when they've got like a SWAT intervention, or they have all of that, that this CARES program really fit the mold for the community and what we asked for. Again, we never get everything we asked for. What we asked for was for the CARES program to do homelessness services. We asked for it to do mental breakdowns that someone was having without a weapon. We also asked for it to be nuisance calls. The police didn't go as far as the nuisance calls. And they said not because it wasn't a good idea, but let's control the scale and the scope right now for better looking at the numbers. So our new ask is for our CARES team to also handle nuisance calls. And if y'all have been following in Charlotte, we had a big issue last year with the city recriminalizing some homeless ordinances that we didn't really like. We were able at the negotiating table to throw in, if you're going to do that, what are you going to do on the other side instead of punishment? What are you going to do? And they said, well, what do you want? So we came back and said, hey, we know we want the nuisance to be part of CARES. They said, no, told you we're not going to do that. But we will extend the program's hours, because right now it was an 8-hour shift. So now we've got 2 8-hour shifts. And yeah, I don't want to talk too long, but yeah, that's where we were.
That actually leads to my next question. But before I get there, I have to, apparently there's a burgundy Honda out front that has hazard lights on. So if that's your car and you need to turn them off, I wanted to give you that opportunity.
Yeah.
So your comments really, my next question was to ask our panelists, from your perspective, what has been the impact, if any, to date of the work of the task force, and you really addressed that. So I want to offer the other two panelists. Is there anything you want to tell us about? We've been at this 4.5 years, since May of 2020. Is anything different now? Have we contributed to those changes? What have you seen on the ground?
Well, I mean, I'm looking at it from the reentry standpoint because that's what I'm most concerned with, and I haven't seen many improvements in reentry. I know we have a SRCC. I know they have recommendations. We have a governor's task force, and we have recommendations. But on the ground, I haven't seen any difference. Regarding the reentry council model, the question is does it work? I mean, is it working in all places? And they're not the same in all places. So, it's just so many questions I even have about that model. I don't even go to those meetings. But when I look at what's needed right now, and I look at what we're doing at Operation Gateway without the stronger partnership that we need with DAC, because to have the best practice for reentry, you have to have a good relationship with the prisons. And I seen in one of the recommendations, I don't know if it was TREC, I don't know if it was SRCC, but it had mentioned in there having a better relationship between the prisons and the community-based organizations, you see. But that's not happening. It's not happening. And I'm not going to just point my fingers at the prison, because I know several of them are short-staffed, and I know what it feels like to be short-staffed. And so a short-staffed prison doesn't have the capacity for the community-based organization to come inside, which is the best practice. So this means that we are not operating in best practice right now, no matter how many committees we have. We can blame it on the staffing. But what we're doing at Operation Gateway to address it, they have that new text behind and getting out systems, the tablets. If you're on LinkedIn, follow me on LinkedIn. I just did like a shout out to one of the people who are incarcerated who's doing his own case management, because the ones that are serious gonna figure it out. And a lot of times there's turnover in those case management positions that keeps them from being able to provide a safe reentry plan. And you want to talk about the racial inequities with the workforce board resources. I used to work on the inside. Remember, I told you I was like a bull in the china shop. And so when you look at the access, because we're talking about equity in this room, right? When we talk about the lack of access for formerly incarcerated people to workforce board resources, we could improve that if the community-based organizations had access to the people pre-release, which is the what? Best practice, you see. And so we can have all of these reentry councils in the world, but if the reentry councils are not prioritizing going inside the prisons pre-release to assess their needs, establish rapport, get them on the Medicaid we was just talking about, you feel me? Get them on the behavioral health component. Then it's violent inaction. Nothing's really happening. And from the outside looking in, it's like, we're doing this. And then all the people that don't know nothing about the underground work is like, yay, we're killing it. And then all the people that need the help the most ain't getting a daggone thing, you see? And so when we're talking about the Medicaid waiver, we're talking about medication for opioid use disorder, we're talking about combating the behavioral health stigma, we have to get the community-based organizations inside the prisons, because it's the lived experience that combats the stigma. When I go in there and I say, yeah, bro, I used to smoke crack, pop, eat pills, and I'm on mental health medication, and I see my therapist, and I'm popping. You see these J's? That's why I dress like this. I could be in a suit too, but I choose not to, so I can be relatable, you dig? And so when we're able to go on the inside to the prisons who allow us to, it's beautiful. But not all prisons act the same. They all got their own rules, and some are more racist than others. Yeah, I come from Western North Carolina. You know what I'm saying? But these are the things that we need to look at. Like, some of these solutions look great. They sound great. But how do we truly hold systems accountable? Out of what? 2 people in here with lived experience. You know what I'm saying? And so these are the components that we have to take into consideration if we want to see true impact and not smoke screens. And it has to be, we have to call out violent inaction. Because I've presented for the NC Works Commission, I've presented for the DAC conferences. I don't do that no more, because I go in there and I step on toes. And you can't be good trouble but for so long before it's no longer, you know what I'm saying, good for your mental health to go in some of these spaces, right? So I don't know what the next move is for the TREC, but I tell you, we can talk about cultural relevance. We can talk about geographic inequities for the people from rural areas that don't have access to medication for opioid use disorders. But we really have to dig in if we're talking about having an impact with these solutions. And these solutions sound great. I've seen some of them, I was looking through them and they sound great, You know, and especially as we talk about Medicaid, and the time is now. We need to have an ad hoc committee to talk about what this 115 waiver gonna look like. Because if we want to get some community-based organizations on the inside, now is the time. Peer support specialist is an evidence-based model. This is where you can take the lived experience and the success stories that gives these men and women hope. And you can take these people who have a hard time getting any other kind of jobs, but they went through the school of hard knocks, put them in there to help them with their Medicaid waiver, and let them share their stories and then welcome them home, instead of waiting till last minute till they get out to come see a reentry counsel when they get out of prison. Like, reentry happens, it starts before you're released. And until we are really doing something about that, it don't matter how many committees or resources we have, the people are still going to get the short end of the stick.
Well,
Lisa, that was
I
my.
make a motion, we adjourn.
That really was my next question, which was, thank you for that. That really was also addressing the next question, which was, what do you think are the biggest barriers to making progress towards eliminating racial disparity? So Letha, you have an option. Answer either question you want to.
I think when I think about my work, I think we have a hard time at the school level, and I'm saying we loosely because it's not me. I'm not really a part of the we, but folks who have decision-making power at school district levels oftentimes want to focus on where they see rates decrease when we think about suspensions, expulsions, and referrals to law enforcement, but they miss the caveat, which is there's still a racial disparity in these different categories that has not decreased. I literally had a conversation with Superintendent Dr. Robert Taylor for Wake County yesterday at a meeting, like, okay, the new data came out for last year, and I see that disparities for Black students still are high. And when can we sit down and talk about what we can do to change that? So I think one of the challenges we have in this work is that we like to pat ourselves on the back and say we've gained progress, but when it comes to like digging beyond that lower number, we don't want to do the work of really addressing why we have such disparity when it comes to race. And I'm a proponent too. I was reading you all's original report, and some of the language, like I heard, especially looking at the information around schools, or it said people of color. And I'll just have to lift up that people of color, when we use that language, we hide. We actually aren't getting at the full disparity. Yeah, I'm a person of color, but I'm a Black person first, right? And so I think when we're doing this work, it's first important to name the different levels of disparity and the racial and ethnic groups so that we can see a full picture. Because if we're not even giving ourselves a full picture of what's happening, how do we change anything? We're just pretending. And I just think that we have to stop doing that. And we have to be bold and unapologetic. I don't work in the system because, to my brother's point, I can't. I wouldn't be able to be my full authentic self within the system, and things within the system, people like yourselves, right, who work within these systems that we're talking about have, I think, have to lean into naming the things so that, to this brother's point, he's not the bull in the china shop when he's working within the system. And then you have to tap out because nobody's supporting you. So I just encourage us to be bold if we're not. And I don't know y'all, right? I only know Curran here, and Anita. But I'm encouraging us as we lean into this work that even if this task force goes away, that the work of the task force has to keep going. That you all have made a commitment to this work, at least for these 4 years, that you don't lose that commitment and find a way to still make this work happen, even if the next person isn't as committed as our current governor.
So I want to ask you to follow up with you, if I may, for just a moment. Following up on what you said about some masking some of what's going on. So you have identified that you work, it's school to prison pipeline work, but it's also school to prison to deportation.
Yes.
Work. And could you say a little bit more about that?
Yes, right. So y'all know, we just got this terrible law passed, right? That is really going to has the potential to have horrific consequences as it relates to the school to deportation. Because if a young person is arrested in school, they are processed through the county detention. And now that we have to cooperate, everybody has to cooperate, the fear of deportation is really out there looming in our communities. But what that also is now doing is there are going to be families who opt out of sending their children to school. There will be children in our state who won't get an education because of the fear, that the real fear. We have fielded so many conversations, phone calls since November from our families who are deathly afraid. So what does that do to this state, to the viability of this state, if we're not even able to get our kids to go to school, whether they're documented or not, right? So there is a real potential in the next couple of years for us to really see an uptick of young people being deported because of something that happens in school. And we should all be concerned about that.
Thank you. So I know that this meeting was supposed to end in 2 minutes. What I'm hoping is that I can indulge on your time. I know some people have other commitments and will have to leave. I want to ask my co-chair, it seems to me the one important official thing we should do as a task force, and then perhaps we can continue this discussion for at least another 10 or 15 minutes, is the memorandum that we circulated. And I think what I would, if you agree, what I would like to ask is just, is there any, it is not perfect. There are things that should be in there that we missed. This was a product of the committee that met to talk about the future work. I think when you combine that memorandum with our 2024 report, there's a much more complete picture. So this is not the be all and end all, the best memo, but my question would be for task force members, is there any objection to us providing this memo to the people it's addressed to? And if not, and then there's plenty of time, you know, for supplemental ideas, additional things that should be in it. But I would hate for us to end this meeting without a sense of the group about whether that's something we can communicate to the governor, attorney general, and the incoming governor and attorney general. So I just raised that question, sort of like speak now or forever. Well, it looks like we have consensus on that. So let's continue this discussion. And I want to, and I understand if people have to get up and leave, no disrespect. So I want to make sure that we get from our other panelists. So Letha, you talked about a little bit, you know, things we need to address in the future. But, you know, are there promising avenues for change? You know, sort of things that you think could happen, or more specifically, important upcoming issues that we need to be focused on.
So again, following up with her is defining and giving as much definition as you can to issues. You know, we are a Black and brown organization mostly, and it's the same thing. So like when we'll talk to our conservative counterparts, then they'll say, well, Robert, you don't have to worry about anything because, you know, this is only going to be affecting criminals or folks that are criminals, and your base isn't criminal. But in the same time, being from South Carolina, even though close to Asheville, but still South Carolina, criminal is defined on however that particular police department or sheriff wanted to define criminality. You know, it could go back to the days that it was peonage. It could go back to whatever. So here, in her example, I get a fender bender, and the person that hit me was undocumented. Now I'm a criminal. You know what I'm saying? So without definition, which y'all are the people that are best at coming up with definitions for folks, there won't be any uniformity. And some places will use as much as they can, you know, the not being written up and defined to imprison people. We see it all the time, whether we're talking prison pipeline or just in my neighborhood stuff with just being Black or brown and having an interaction. That's why we want less interactions. But if y'all don't define stuff now, with the current administration that's coming in, not talking about the governor, but talking about the folks that fill up one building, they're going to define it differently. And you're going to see arrest in Gaston County different than Mecklenburg County, different than Forsyth County. And that right there shouldn't be in the arrest to start with. But leaving it up without definition is something that y'all can have in your toolkit that I think y'all could use.
Yeah.
Oh, I'm optimistic. I'm a man of prayer, and I believe that broken hearts change minds and policies. I'm very excited about what we can do in North Carolina with prison reentry and where we can go. So if anybody in the room is about that life, I would love to talk further about what we can do together. I consult across the Appalachia, so I don't just do work in North Carolina. So I would love for it to benefit my home state as much as it is some other places. But I do know it was harder for Jesus in his hometown, right? Mm-hmm. So I keep that in mind. But I may have came in here passionate, but do know I'm passionate with tangible tactics and next steps. So we can improve reentry. We can think differently from what's existing. And the reentry councils are not the only way. I hope that y'all understand that is not the only way to do reentry.
I want to open it up. Do task force members have any questions or reactions or comments?
So I was excited that you're excited about 1115. At the same time, there's going to be a big change in this state leadership. I think most of the folks at DHS are going to stay. So there's the folks who've driven it. But, particularly in Charlotte, I would imagine y'all work a lot with certified peer specialists and peer, from my experience in this task force, peer not only means folks with lived experience with a disability, but also lived experience with the incarceration of the criminal justice system. And I'm just curious if you have any suggestions as we sort of move forward with 1115 on how peers can be really a part of that process.
So we're currently doing it now. We have a registered apprenticeship with the Department of Labor. We have some suggested trainings because, lived experience is a part of it, but lived experience without the proper training can have a whole bunch of passion and do more harm than good. Yep. And so we want to make sure they're properly trained, make sure they have a significant amount of sobriety if they were on drugs, right? We don't just want to throw them in there after a year. You have to wait a year to be off your probation to be able to go back into the prisons. So we want to make sure that they're properly trained. It can totally be done. We're doing it now. So we have a contract with the Healthy Opportunities Pilot, doing that kind of work, partnering. Our funding is coming. A lot of the funding coming to us comes by way of DHHS through our LME, Value Health. And so it's beautiful. It can be totally scaled up and it can be improved if we had access before they get out of prison. Mm-hmm. That's the biggest missing piece, I would say, is being able to connect with them before they get out.
On the administrative piece, I like to follow up. What I see a lot of, and I used one example of people meaning well and do the t-shirt, release the balloon, where there's also the other piece that the people with lived experience can't get it because they haven't been a C3 for 6 years. They can't survive an audit because the audit was $100,000. And is your stuff evidence-based? And again, I hate it, but if the only people that define evidence-based is white people, then your evidence-based methodology is not going to always line up and work. So finding ways to fund the people that actually can do the work. Does that make sense? So we have that in Charlotte all the time. It's like, how do we first on our side line up the money, cure violence, get all of that, get the money there. Now, how do I make sure that the trusted messenger, the person that's going in the neighborhood, can be the trusted messenger? Because even though he's trusted on the message, the powers that be don't trust him on the fiduciary part. I hate that commercial. I will never take your money. I'm a fiduciary. But that's exactly the point.
You mentioned healthy opportunities really quickly. That's been expanded. It was just in your region and a little part of the coast, and now it's going to be across the country or the state.
And I love when I introduce myself, outside of the state. I'm so proud to be a North Carolinian because it's big. Like, and it's able to address the behavioral health component, like people that was on medication or aged out of foster care and got dropped off, and now these people are able to get their mind right. You feel me? And the people in prison a lot of times are people who are self-medicating. So it would behoove us to connect with them while they in there, because you got a captive audience when they in prison. You know, when if you wait until they get out, it's over for them. They're gonna self-medicate before they go trying to make an appointment and do all of these appointments when the halfway house saying you owe us money, baby mama saying you owe me child support, probation saying you owe us fines and fees, DMV. You know what I'm saying? It's just too much to think that they're gonna take care of that once they get out.
I do have a question. So if I want to make sure I'm tracking this right, the reentry portion of what we're doing is not attaching to folks until they're already released?
For the most part, yes, sir. And I'm gonna say the prisons are short staffed, because I'm trying not to be just so mad at the prisons no more. Because I used to be pointing my finger just mad, you know what I'm saying? But I'm learning to be more gracious. And a short staffed prison doesn't have the capacity to allow the programs to come in like that, because they got to have a certain amount of staff, especially at certain custody levels. You see, so for the most part, you're seeing people who are connecting with these reentry councils once they get out of prison.
So what would be the ideal time frame if for the folks who want to push this along? Because it makes sense to me, like, if we're going to spend money and we're going to invest, we need to do it prior to them being released to the street, because there's a lot of things on the street that's calling them, and they have to be educated and able to deal with those things prior to being introduced into those environments. So what would be the ideal time frame to
shoot? 90 days is good, but you used to have, back in the day, you had some programs going in there like Project Reentry and all these things. But then comes another thing, Task Force for Racial Equity. They wasn't getting culturally relevant services, because they was typically the people who was working in them reentry programs, they was giving them peanuts. So, and a lot of them didn't have lived experience. And so you would have these programs that was going in, but they wasn't having the impact that they could have because they wasn't culturally relevant. You see? And so if we have programs, and there are some evidence-based programs that we can go with, that we can get back inside the prisons, teach them about financial literacy, teach them about, family reunification, teach them about mental health and the role that it plays into decreasing recidivism, but talking to them, meeting with them once a week. If we can get back to that, that'll help a whole bunch of people, because by the time we get them now, they ain't getting their GEDs in prison like they used to. It's just so many things. The pandemic tore us up. You hear me? And so this is where we got to get back to, but it has to be culturally relevant services. When I was in prison, I was blessed. It was a brother named Brent Bailey. He's the coordinator for our local reentry council. He was my project reentry teacher. And when he came in, he revealed that he had been formerly incarcerated. My ears perked up then. You know what I'm saying? Lived experience is the superpower. It's not the only thing. You don't got to have got an opus number to be impactful. But that opus number holds a lot of weight if you got somebody that's done turned their life around. So we can get programs back in the prison that are culturally relevant and meeting the needs of not only the workforce, but the behavioral health needs, the financial literacy needs, because people forget about that financial literacy component. Some of y'all in here stressed out now because of Christmas time. You know what I'm saying? Yeah.
I mean, I hadn't done one bit of Christmas shopping.
You got older kids.
Water's hot. I guess my thought then is, and this is just a thought. It would appear to me that preparing folks for reentry the moment they are incarcerated is the best option.
Yes, get their vital records. Like, why can't the processing component, get your birth certificate, ID, and social security card then, and put it in a folder for the rest of the years.
Yes.
They get out now, they can't even get a daggone ID.
That's the biggest thing that we have once they re-enter and get back in the community, and we try to get them a job. So I don't know if any of y'all watched lately. We have this issue in Charlotte where we've had 2 mass displacements. And the 2 mass displacements was Lamplighter Inn, which people couldn't afford to live, had to live in the inn, and another was a place called Tanglewood. And they were living in bad conditions, but they were living in bad conditions and they had a roof over their head. And when we had to condemn the hotel, the 60 that came out, a lot of them were either reentry or over time had just gotten disconnected from the system. So Charlotte means well. So Charlotte's like, we're going to help you find a place. Well, first you got to help them find an ID, because, I spent time on the phone. This place says I'll accept crisis assistance money for them to put them up for a week while we do stuff. I get them down there. The person at front desk says, I need your ID. And the person says, here's my prison ID. They said, we don't accept that. Or here's my ID, but the date was expired. You can't accept that. So now the woman and her 2 kids can't check into the hotel, even though I got the money, because they don't have an ID. And I know that we talk about this a lot with voting, but we don't talk about it in just being humane and humanity given to it. Because again, I'm going to fight as much as I can for undocumented people. I'm going to fight as much as I can for others, but I also got to fight for my people that have been deprived. And when they got out of jail, if they could have just made them a state ID, you know, before they went out, that's huge. And yeah, I can keep going, but that's huge.
Wondering if you can, so from my perspective on the inside, I mean, your delivery might be a little different, but the words you're saying are actually not that different from what we hear from leadership at TAC and in the prisons. But it's very clear to me, especially as a spouse of someone who works in a prison as a clinical psychologist, that there is a disconnect. And I'm wondering if leadership agrees that, you know, reentry begins at incarceration and that there needs to be sort of, as Sheriff Burkhead and I were talking about, a very long one way and all of the things that you're saying. Where is the disconnect from your perspective, if the goals identified and even some of the strategies seem the same? And is it at the facility level? What else do you see?
I can just do overview. But I can tell you it's because who's sitting at the table, and there's less people that's been impacted, just this impacted. So like when this committee, if y'all continue, please get Tijuana Brown, our councilwoman, on here, because you know she's at least, I think, the only person with a criminal record that served time that's sitting on city council. Having people like that make sure that the language is right. You know how back in the day, I don't know if y'all old enough to remember Sanford and Son, you had the black cop and the white cop, and you had to take the white cop would still say stuff, and the black cop had to say, but what he's really saying is, that's the systemic problems on everything that has to do with paperwork, who sits at the table, and who's the fiduciary. But those 3 things right there, you get killed if you don't speak the right stuff.
And I can speak to an add-on with being on the Joint Reentry Council 2030. DAC, from my perspective, realize that it's definitely an issue with not being able to get inside of the prison, and always revert back to short staffing, as he said, right? And COVID hitting, and it collapsed a lot of the models of being able to help people. And so I think once they figure out the staffing part, if they figure that part out, and getting people in there ahead of time, he say 90 days, I say 6 months. We give them 6 months, we work with them 6 months till they get out, and then once they get out, it's just like a handoff. Essentially, you be hand off with the same person, you just now be on the outside. And so I think from my lens and my purview, my perspective, that's something that I continue to push. But like I said, I'm only one person, one voice, but with lived experience, and so got the best seat at the table. And while I'm talking, I would like to thank each of you all for coming in here and presenting. It was very impactful, very insightful. As always, love to hear you all, have your perspective, but also bring it into rooms like this where it's definitely needed. It feels good to not be the only directly impacted person.
So, just I got it. You're the guy I follow on Twitter. You been with Christy Puckett? Yeah. See, I know. I know. I don't know you, but I know you. But that's also the good thing now. You know what I'm saying?
Some questions on this side.
I just wanted to say that listening here and thinking about what is important, it looks like it's just we're documenting why emphasizing for the next administration and for each of us who will be in whatever roles we'll be in our lives ongoing, to commit to keeping this kind of dialogue going, where we ourselves are in conversations with people with lived experience about these issues, and making sure that the folks in the important jobs, there's some folks there who are committed to this, and, do what we know needs to be done politically to keep these kind of things going. And we know that for DAC, it's funding and budget and staffing, security, it's all those things we've heard before. And we have to make sure that we're there, that we and some people like us are there to keep these conversations going in the rooms going forward. And what that looks like and how we do it I don't know, but we have people around the table who can have, each of whom can have some influence on it.
Only one subject that y'all didn't bring up that I've really seen, especially on this clemency, the parole commission in North Carolina is broken. Commissioner Bryant would know that, but I have watched cases, they have come up for parole 18 times denied. They don't even have reviews. There's so many to review. Unless they affirmatively come in and say, I want a hearing, it's a file that goes for the next 2 years. We have got to look at that. It affects the safety within the prisons because they give up hope. They have no infractions. They're coming up again. They weren't told they had a hearing. It's gone for 2 years and there's no hope. And I think we really need to look at that. It's one of the TREC recommendations and I hope it does not go off the radar.
Another question?
Yes. Yeah, so there's a different political environment in Washington coming up, and and it's been interesting this last 4 years to sort of go from the murder of George Floyd and racial equity becoming sort of a really important topic to one that people really are running away from, and it's been somewhat outlawed. Yeah, I guess my question for y'all is just sort of what recommendations do you have to sort of keep this in a way as you've moved from sort of laying on the railroad tracks to.
But we're gonna still do
working.
that.
Well, and I hear that, but in my work, I really want to and need to work with both sides of the aisle and really find friends. And I guess my question is, how do we keep the momentum going when, at least for the next year or two, there's going to be some people who are concerned about a task force called the Task Force for Racial Equity and Criminal Justice?
I think part of the strategy, even if it can't be something that's happening at the state level, is to think about local level task force. And because part of our work that we're thinking about, that I didn't say, is thinking about how we create sanctuary spaces and ensure that schools are sanctuary spaces. And so there are policies that have been passed at the local level in school districts across the country that speak to sanctuary. And so one of the things I think this task force can do, if you can't do it at the state level, is to think about how we set up individual, regional, or local level task force that kind of allow you to fly a little bit under the radar of a state level iteration would be mine.
So again, like those two cops on the black cop side, you got to change the narrative. So one of the main reasons I was able to get things passed in Charlotte is you have to change the narrative to who you're talking to. So if I'm talking to the conservatives on there, I have to say, it cost you to send out on a call. You sent out a police officer. That was an $80,000 car, Mr. Republican, with $30,000 worth of equipment getting paid. You spent for that one interaction. You spent $6,000. I bet the folks in South Park don't know that. You're like, oh, that's a lot of money. So with this new iteration, don't call yourself a task force. Call yourself a fiduciary.
And I'll say, regarding the new administration, he always cared about reentry. I have people that have served that was released by President Trump that have videos with him. And so workforce development needs to be talked about more for that side, and how we impact small businesses and how to get people portable credentials and how to best leverage those federal workforce dollars. That would be something we could move on the next phase of this fiduciary here, because this work needs to keep going. And that's why even in my engagements now, I don't just say equity by itself, because the word equity got its own view. But when I start breaking down that geographic component of it and start talking about how people from Graham County and Cherokee County, them people from the sticks, are overdosing and back on that meth, and how families get torn apart, and we got a program in Asheville to get somebody in a halfway house and some workforce development, I'm like, yeah, that sounds good. But if I would have said equity going into that meeting, they would have all shut down in them rural, some of them rural areas. And so adding that workforce development component and just looking at using different words, because we're gonna still need to do the same things. And if we're careful with what words we use, just like it is in recovery and in the addiction profession, we teach people how to use certain language. Like some people say offender, we never say offender. You know what I'm saying? So it's certain language that we're just going to have to use that's going to cater to whatever administration it is, but still have the same end goal.
Great. Well, let's thank this amazing panel. We really appreciate you traveling to be with us today and for those perspectives. I think we've gotten such useful information, as well as being inspired, as well as being clear-eyed about what we're facing. We're way over time. Secretary Ruffalo, is there anything more you want to say to conclude our meeting?
Thank y'all for coming. Thank you for your
Thank y'all.
passion, your conviction, and I think you've given us some roadmaps for the next administration to take a look at. So
Awesome.
I appreciate the work you do.
Thank y'all.
Thank you.
Well, I want you all to know that we are in process of letters from the governor to thank you for your service on the task force. And so look for those in the mail. And I am just incredibly grateful to all of you. And I know we will continue to work together in some fashion. So,
Thank you.
Yeah.